Ladies and gentlemen, today I want to draw your attention to something most people ignore until it's too late: their feet. These are not just structures that carry your body weight. They are early messengers of deeper health conditions, especially diabetes. The reality is, diabetes often develops silently, and one of the first places it reveals itself is in your feet. If you pay close attention, your body will give you signals long before serious complications arise. Let's begin with one of the earliest and most commonly ignored signs: tingling, burning, or numbness in your feet. Many people describe it as a pins and needles sensation, like when your foot falls asleep. Others feel a persistent burning or a strange loss of sensation, as if they're walking on cotton. This is not something to take lightly. What you are experiencing could be nerve damage, what doctors call diabetic neuropathy. When blood sugar levels remain high over time, they begin to damage the tiny nerves, particularly in the extremities like your feet. At first, it may come and go, something you barely notice or dismiss after a long day. But gradually, it can become constant, more intense, and more dangerous. The real risk is not just the discomfort, it's the loss of feeling. When your feet lose sensation, you may not notice injuries like cuts, blisters, or burns. A small, unnoticed wound can quickly worsen, leading to infections that are much harder to treat. This is how serious complications begin, quietly and progressively. I've seen patients who ignored this early warning sign, thinking it was just fatigue or poor circulation, only to face severe consequences later. So, if your feet are sending you these unusual sensations, understand this: it's not random and it's not harmless. It's your body signaling that something deeper is wrong. Listening early can make all the difference. Now, beyond nerve-related symptoms, there are other changes you should never ignore. For example, a small cut or blister that refuses to heal within a normal time frame is a major red flag. Healthy bodies heal quickly, but diabetes slows this process due to poor blood circulation. When blood flow is compromised, oxygen and nutrients don't reach the wound efficiently, delaying healing and increasing the risk of infection. Similarly, changes in the color or temperature of your feet, such as them becoming unusually cold or developing a bluish or pale tone, can indicate circulatory problems that need immediate attention. Dry, cracked skin is another subtle but important sign. While dryness might seem minor, in people with diabetes it can lead to openings in the skin where bacteria can enter. Over time, even small cracks can turn into serious infections. You may also notice structural changes in your feet, like bunions or unusual pain while walking. These changes often result from nerve damage, affecting how pressure is distributed across your feet. Lastly, don't overlook your toenails. Thickened, yellow, or brittle nails, along with persistent fungal infections, can be signs that your immune system is struggling, another effect of uncontrolled blood sugar. The message is simple: your feet are trying to tell you something. Pay attention, act early, and never ignore the warning signs. Ladies and gentlemen, there is another warning sign that deserves your full attention, and it's one of the most dangerous because people tend to underestimate it: a cut, blister, or wound on your foot that simply refuses to heal. At first glance, it may seem harmless. You might think, it's just a small injury, it will get better in a few days. But when days turn into weeks and there is little to no improvement, that is not normal. That is your body raising a serious alarm. Under healthy conditions, the human body has an incredible ability to repair itself. Even minor injuries begin healing almost immediately. But when diabetes is present, especially when blood sugar levels are not well controlled, this natural healing process slows down significantly. Why does this happen? Because diabetes affects blood circulation. Blood carries oxygen, nutrients, and essential immune cells that are required for healing. When circulation is poor, these critical elements don't reach the wound effectively, and as a result, healing is delayed. Now here's where the real danger begins. A wound that doesn't heal becomes an open door for infection. Bacteria can easily enter through even the smallest cut, and in a person with diabetes, the immune system is often not strong enough to fight it off efficiently. What starts as a tiny blister from a tight shoe can slowly develop into a deep infection. In some cases, the tissue around the wound begins to break down, leading to ulcers, painful, open sores that are extremely difficult to treat. And it doesn't stop there. If the infection spreads and is left untreated, it can reach deeper layers of tissue, even affecting the bones. At that stage, medical intervention becomes urgent and aggressive. In the most severe situations, when the damage cannot be reversed, amputation may become the only option to prevent the infection from spreading further. This is not meant to frighten you, but to emphasize how serious a simple, non-healing wound can become. What makes this even more concerning is that many people with diabetes also experience reduced sensation in their feet. That means they might not even notice the injury in the first place. By the time they do, it may already be infected or worsening. This is why regular foot inspection is absolutely essential. You have to look for cuts, blisters, redness, or swelling every single day. Let me be clear, any wound that does not show signs of healing within a reasonable time frame should never be ignored. It is not something to treat casually at home with guesswork. It requires proper medical evaluation. Early treatment can prevent complications, but delay can lead to consequences that are far more serious than most people imagine. Your body always communicates with you. A wound that won't heal is not just a skin issue, it's a deeper warning about your internal health. Listen carefully, act quickly, and take it seriously. Ladies and gentlemen, another important signal your body may be sending lies in the subtle but noticeable changes in the color and temperature of your feet. These are not random occurrences, and they are certainly not something to overlook. In many cases, they are early indicators of underlying circulation problems, which are closely linked to diabetes. You might notice that your feet sometimes appear unusually pale, slightly bluish, or even reddish without any obvious reason. At other times, they may feel colder than the rest of your body, even when the environment is warm. Some individuals describe it as a constant chill in their feet that doesn't go away with socks or blankets. These changes may seem minor at first, but they can point to something much more significant happening beneath the surface. To understand why this occurs, you need to consider how blood circulation works. Your blood is responsible for delivering oxygen and essential nutrients to every part of your body, including your feet. When diabetes is present, especially over a long period, it can damage blood vessels and restrict proper blood flow. This condition, often referred to as poor circulation, means that your extremities, particularly your feet, do not receive the supply they need to stay healthy. When blood flow is reduced, the skin can begin to change color. A pale appearance may indicate that not enough blood is reaching the area, while a bluish tint could suggest that the oxygen levels in the blood are lower than they should be. In some cases, redness may occur as the body tries to compensate, sending more blood to certain areas in response to irritation or pressure. These shifts are not cosmetic. They are physiological warnings. Temperature changes are equally important. Feet that feel consistently cold may be experiencing reduced circulation. On the other hand, unusual warmth in certain areas can sometimes indicate inflammation or infection, especially if it's accompanied by swelling or redness. Both extremes, too cold or unexpectedly warm, should raise concern. The real danger lies in the long-term effects. When circulation is impaired, the tissues in your feet do not receive enough oxygen and nutrients to maintain their health. Over time, this can lead to skin breakdown, delayed healing, and an increased risk of ulcers or infections. Combined with nerve damage, which may reduce your ability to feel pain, these issues can progress without you even realizing it. What makes this particularly concerning is how easily these signs can be dismissed. People often blame cold feet on the weather or poor circulation on fatigue without considering a deeper cause. But when these symptoms persist or occur frequently, they should not be ignored. Monitoring your feet regularly is essential. Pay attention to any unusual color changes, persistent coldness, or areas that feel different from the rest. These small observations can provide critical insights into your health. Your feet are constantly communicating with you. Changes in color and temperature are not just surface-level issues. They are internal signals that something may be wrong. Recognizing them early and seeking proper medical advice can prevent more serious complications down the line. Ladies and gentlemen, there is another sign that often appears quietly, almost unnoticed, yet it carries significant importance: dry, cracked skin on your feet. Many people consider dry skin to be a minor inconvenience, something caused by weather, dehydration, or simply aging. They apply a bit of lotion and move on without giving it much thought. But when it comes to diabetes, this seemingly small issue can become a doorway to much larger complications. Your skin plays a critical role as a protective barrier. It keeps harmful bacteria and external threats from entering your body. When the skin is healthy, it is flexible, slightly moist, and resilient. However, in individuals with diabetes, this natural balance is often disrupted. High blood sugar levels can affect the nerves that control moisture in your skin, particularly in your feet. As a result, your skin may lose its ability to stay properly hydrated, leading to persistent dryness. At first, this dryness may appear as rough or flaky patches. You might notice your skin peeling slightly, or feeling tighter than usual. Over time, if this condition continues, the skin can begin to crack. These cracks may start off small and shallow, but they can deepen, especially in areas that bear weight, such as the heels. And this is where the real concern begins. Cracked skin is not just a cosmetic issue, it creates openings. These tiny breaks in the skin can act as entry points for bacteria and fungi. Once microorganisms enter, they can cause infections that may be difficult to control, particularly if your immune system is already compromised due to diabetes. What started as simple dryness can escalate into redness, swelling, pain, and in more severe cases, open sores or ulcers. Another factor to consider is that many people with diabetes also experience reduced sensation in their feet. This means they might not feel the discomfort or pain that would normally alert them to a problem. A crack in the skin could worsen over time without the person even realizing it. By the time it is noticed, it may already be infected or require medical attention. In addition, dry skin tends to be less elastic, making it more vulnerable to damage from everyday activities like walking or wearing shoes. Friction can easily aggravate the condition, causing the cracks to widen or deepen. Without proper care, this cycle continues, increasing the risk of complications. It's important to understand that managing dry skin is not just about comfort, it's about prevention. Regularly moisturizing your feet, especially after washing them, can help maintain the skin's integrity. However, it's equally important to monitor for any signs that the dryness is becoming more severe or is not improving with basic care. The key message here is simple: do not ignore dry, cracked skin on your feet. It may seem harmless at first, but it can quickly develop into something far more serious if left untreated. Your body is giving you subtle warnings, and it is your responsibility to listen. Taking care of your skin is taking care of your health. Small steps today can prevent major problems tomorrow. Ladies and gentlemen, there is another warning sign that often develops gradually, making it easy to ignore until it begins to interfere with daily life. Changes in the shape of your feet, along with persistent or unusual pain. Many people assume foot pain is simply the result of aging, long hours of standing, or wearing uncomfortable shoes. While those factors can certainly play a role, in the context of diabetes, these changes can signal something much deeper. Your feet are complex structures made up of bones, muscles, tendons, and nerves, all working together to support your movement. When diabetes begins to affect the body, one of the key systems it disrupts is the nervous system. Over time, nerve damage can alter the way your muscles function and how pressure is distributed across your feet when you walk or stand. At first, the changes may be subtle. You might feel a slight discomfort in certain areas of your foot, or notice that your shoes no longer fit quite the same way they used to. Gradually, however, this imbalance can lead to visible deformities. Conditions such as bunions, where the joint at the base of the big toe becomes enlarged, or hammer toes, where the toes bend abnormally, can begin to develop or worsen. These deformities are not just structural, they change how your foot interacts with the ground. When pressure is unevenly distributed, certain areas of the foot bear more weight than they should. This creates points of excessive pressure, leading to calluses, corns, and in more serious cases, skin breakdown. Over time, these pressure points can develop into ulcers, especially if combined with reduced sensation in the feet. Pain is another important signal. While some people with diabetes may experience numbness, others may feel sharp, aching, or persistent pain in their feet. This discomfort may occur during walking, while resting, or even at night. It might come and go at first, but gradually become more consistent. Pain should never be dismissed as normal, especially when it is ongoing or worsening. One of the challenges with diabetes-related foot problems is that they often develop slowly. Because of this, people adapt without realizing it. They may change the way they walk to avoid discomfort, or ignore minor changes in appearance. But these small adjustments can actually make the situation worse over time, increasing stress on other parts of the foot and accelerating damage. In more advanced cases, severe deformities can lead to significant mobility issues. Walking becomes difficult, balance may be affected, and the risk of falls increases. What began as a mild discomfort can eventually limit independence and quality of life. This is why early attention is so important. Regularly examining your feet for changes in shape, swelling, or pressure points can help you catch problems before they progress. Proper footwear that supports your feet evenly can also play a crucial role in preventing further damage. The key message is clear: your feet are not supposed to hurt, and they are not supposed to change shape without reason. When they do, it is your body's way of telling you that something is wrong. Listen carefully, take action early, and never underestimate the importance of these warning signs. Ladies and gentlemen, there is one more warning sign that many people tend to overlook, often because it seems more like a minor hygiene issue than a medical concern: changes in your toenails and persistent fungal infections. But in reality, these small changes can be strong indicators that something deeper is affecting your body, particularly when it comes to diabetes. Let's begin with your toenails. Healthy nails are usually smooth, slightly pink, and firm. But when you start noticing that your nails are becoming thick, yellowish, brittle, or oddly shaped, it's not something to ignore. These changes are often caused by fungal infections, which thrive in warm, moist environments like the inside of shoes. While fungal infections can affect anyone, they tend to be more frequent and more severe in individuals with diabetes. Why does this happen? The answer lies in the body's immune response. When blood sugar levels are consistently high, the immune system becomes less effective at fighting off infections. This makes it easier for fungi and bacteria to grow and spread. At the same time, reduced blood circulation, another common issue in diabetes, means that your body has a harder time delivering infection-fighting cells to the affected areas, especially in the feet. A simple fungal infection may begin as a small discoloration on the nail or slight itching between the toes, often known as athlete's foot. Many people dismiss it, assuming it will go away on its own or with basic treatment. But in someone with diabetes, these infections can become stubborn and long-lasting. The nail may continue to thicken, crumble, or even separate from the nail bed. In some cases, the surrounding skin becomes red, swollen, or painful. What makes this particularly concerning is how these infections can lead to further complications. Thickened or deformed nails can create pressure against your shoes, leading to discomfort or even small injuries. If the skin around the nail becomes broken, it creates an entry point for bacteria, increasing the risk of more serious infections. And just like with other foot-related issues in diabetes, reduced sensation means you might not notice the problem until it has already progressed. Another important point to consider is that fungal infections are not always isolated. They can spread from one nail to another, or from the nails to the skin, making the condition more widespread and difficult to manage. Without proper care, what started as a minor issue can become a persistent and recurring problem. Good foot hygiene plays a crucial role in prevention. Keeping your feet clean and dry, trimming your nails properly, and wearing breathable footwear can help reduce the risk. But if you notice any unusual changes, persistent discoloration, thickening, or infections that don't respond to basic care, it's important to seek medical advice rather than relying on guesswork. The key message here is simple: your nails and skin are reflections of your internal health. Changes in them are not just cosmetic, they are signals. When your body is struggling, especially with conditions like diabetes, it often shows in these subtle ways first. Pay attention, act early, and never underestimate what your feet are trying to tell you. Ladies and gentlemen, As we come to the end of this discussion, I want you to remember one simple but powerful truth. Your feet can tell you what your body cannot say out loud. The signs we've talked about today, tingling, slow healing wounds, color changes, dry cracked skin, deformities, infections, these are not random. They are early warnings, signals, clues that something deeper may be happening, especially when it comes to diabetes. Too often, people ignore these signs. They delay action. They assume it's nothing serious. And by the time they finally seek help, the condition has already progressed to a stage where treatment becomes more difficult, more expensive, and sometimes irreversible. But it doesn't have to be that way. Early awareness changes everything. If you make it a habit to check your feet regularly, to notice even the smallest changes, and to take those changes seriously, you give yourself a powerful advantage. You move from reacting late to preventing early, and prevention is always better than cure. Let me be very clear, this is not about fear, it's about responsibility. Your health is in your hands, and small actions taken consistently can protect you from major complications in the future. So examine your feet, care for them, respect the signals your body gives you, and if something doesn't feel right, don't ignore it, get it checked. Because when it comes to diabetes, early detection is not just important, it can save your limbs, your mobility, and your life. Take care of your feet, and you take care of your future. Thank you.